Ladies with large, heavy, pendulous breasts are often afflicted with a lot of problems. You may get pain in the breasts. The weight of the bust might pull on your neck, your back, your shoulders, so you get pain there. The bra straps tend to cut in by the end of the day. You might get affectation of the skin under the fold of the breast, and it might lead to a slump or a poor posture. So these patients want to have lighter, more pert breasts. So I will say to you that every breast reduction involves a breast uplift, but you also take out the weight of the breast. Now, the difference between that and a mastopexy is a breast uplift on its own. So in some sense, a breast uplift is a very similar operation to a breast reduction. You just don't take any of the breast out. So every breast reduction involves an uplift. Every uplift is similar, but with no breast taken out. Now, classically, the scars for a breast reduction and a breast uplift are similar. The usual operation involves an inverted T or anchor-shaped scar. So a scar around the nipple, straight down to the fold, and all the way across under the fold of the breast. And that is the most common scar from breast reduction or uplift surgery. And I used to use it a lot for many years. There are more modern techniques that reduce the amount of scars that you get from these two procedures. So today, it's been a long time since I've had to use the inverted T operation. Nowadays, I can offer surgery that reduces the scar, so it's reduced to a scar around the nipple and straight down only. So a lollipop scar. Obviously, this has a lot of advantages, but one of the main ones is that I get better control of the shape at the sides and under the fold of the breast. A much more rounder, more pleasing profile, I think. Also, depending on which technique you use, you take out the breast tissue in different parts of the breast for each type of reduction operation. The operation that I tend to prefer leaves the nipple at the top and takes away the tissue at the bottom of the breast. Now, what good is that? Well, if you leave breasts long enough, be it with surgery or without, they tend to bottom out because gravity is more powerful than anything. So an operation that takes out the upper part of the breast and leaves the bottom part is going to bottom out as time goes on. It may look good on the day of surgery, but 5 years later, it may not be quite as pleasing. So I've tended to adopt those procedures that remove that part of the breast that would bottom out. Because you removed it, it can't bottom out, and therefore the outcome of surgery, firstly, is a smaller scar, a lollipop scar, and secondly, should last with a more beautiful aesthetic profile for much longer, be it a reduction or an uplift. The risks of breast reduction surgery and therefore breast uplift surgery, although with uplift the risks are less, are those of any operation and those specific to breast reduction. The risks of any operation in breast reduction surgery include bleeding, not life-threatening, infection, we do give you antibiotics, scarring, inevitable, bruising, temporary, swelling, temporary, numbness, and pain. Now, there are some special things about breast surgery because if you're operating on the breast gland, you will be cutting some of the nerve. So I have to say to patients that the feeling in the nipple will be reduced. It's rare to lose it completely. On average, with my technique, you would end up with 65% of the feeling you had before surgery. Losing the nipple itself is a risk. If you did that, I can make you a new one. However, that's never happened. So I think the risk of losing the nipple is less than 1%. You may also lose the ability to breastfeed. Now, those patients who have the big problem with large breasts usually don't worry about that. And sometimes you're of an age that's beyond that as your family is complete. But we have to say to you, it could be affected. That being said, I have had patients who have had breast reduction and gone on to breastfeed. It's always helpful but not always possible to have completed your family before surgery. But we can discuss all of that when you come to consultation in the clinic.